Good morning, everyone. Hope you're having a great week so far. Dr. Steven Zom here with another episode of Tooth Teacher Tuesday. Today, our topic, just kind of answering a common question that we get, is what is bone grafting in terms of dentistry and what is it used for? And so, to basically give you an idea, a couple different situations in dentistry that would need bone grafting. In any situation, it's to correct a concern with bone loss or prevent bone loss. And so the two primary situations that would involve would either be in the event that we are about to remove a tooth and the eventual plan is to replace it, especially if we're planning to replace it with an implant where having as much bone as possible becomes very important. Then we do what's called a bone preservation graft, where after the tooth is removed, some bone grafting material is placed in the socket where that tooth used to be, and what that does is kind of preserve the bone levels to keep them as high as possible, because without some kind of grafting material in there, typically what will happen with a socket after extraction is that it's almost kind of like when a mine collapses. The bone supporting that tooth that's no longer there, that bone just starts to sink inwards, and it isn't lost all the way, but it's certainly not as high as it used to be, which again is important if we're planning to replace that tooth, and especially with an implant where having as much height of bone as possible becomes very crucial. Other situation when bone grafting is typically recommended is in a situation where we've got some periodontal disease, bone and gum disease around the teeth, where we've lost enough bone that a tooth's in jeopardy of being lost without some support around it. And so in that situation, the intention is to try to save that tooth by grafting some bone around the roots to try to build back what's been lost. Sometimes that's easy to accomplish, sometimes it's a little bit trickier. But the ultimate goal being in that case to build back what's been lost, whereas in the first situation it's trying to prevent bone from being lost in the first place. So that's kind of what bone grafting is used for in dentistry, and why, if you've been in either of those situations, your dentist or your surgeon may have recommended bone grafting. As far as what is used in bone grafting, there's several possibilities there as well. Bone grafting materials typically are going to be in one of four categories. One would be natural human bone that's taken from a cadaver, from a human donor that is deceased and has donated their body to science, and so their bone is removed in little pieces, little shavings, and is then obviously sterilized and used to then graft it into someone's mouth. It's also possible that bone grafting material would be an autograft, meaning that the bone is taken from the person who's receiving the graft. That's pretty uncommon for the most part. Typically no one wants to have their own bone removed if they can help it. I would say probably the most common scenario for that is someone who has, we've talked in the past about the little bony nodules that some of us get in our mouth called tori. Sometimes if someone has large tori and they're going in to have those removed, then those bone shavings from having the tori removed can then be recycled and used to bone graft for an implant or for treating periodontal disease. Other possibilities would be a bovine graft, which basically means it's bone material that's used from a cow. I would say that's probably the most commonly used material. Every dentist, every surgeon's going to have their own preference, but bovine is, even though it's not from a human, has a very high success rate of, successfully treating that bony defect, and so it's pretty commonly used, and it's a little bit easier to harvest, a little bit less expensive as well. And then the final, more common type of bone grafting material would be some kind of synthetic bone that's created in a lab. It has all the components and molecules, chemical makeup that typical bone would be made out of. It's just not harvested from a human or from a cow or any other animal. These are obviously very successful as well. Maybe not quite as successful as a human graft or a cow bone graft, but still high enough that it's commonly used, and without some of the potential controversy of harvesting from another formerly living creature. So, yeah, that is kind of the gist of what a dental bone graft is. Hope that was illuminating and helpful for anyone that's curious about the process, maybe is about to undergo the process themselves. And so if you found this useful, I would invite you to join me again next week for another episode of Tooth Teacher Tuesday. But until then, have a great week, and thank you for your time.